Hi friends, today I will be discussing about frozen shoulder or adhesive capsulitis, which is one of the most commonly encountered situations in musculoskeletal OPD. So frozen shoulder is nothing but inflammation of the inferior capsule, which leads to stiffness, restricted movements which can be focally in one external rotation or a global restriction of movements. MRI is done to assess the status of soft tissues around the shoulder joint because adhesive capsulitis is a clinical diagnosis. The inferior capsule normally appears jet black in color. However, in cases of frozen shoulder, the capsule will be thick and edematous and hence appears bright on the fluid sensitive sequences. This is a proton density image where we can see the thick and edematous inferior capsule. Along with that, we can see the rotator cuff, the supraspinatus tendon inserting. On the humeral head, this is a subacromial bursal fluid. The labrum has a small hyperintense bright signal, and this is the articular cartilage. As I move ahead, the important area to assess is the rotator interval, which comprises of coracohumeral ligament, the superior glenohumeral ligament, and the rotator cuff tendons adjoining the supraspinatus and the subscapularis here. This is the coracoid process which acts as a landmark, and hence we can actually appreciate the coracohumeral ligament. In cases of a frozen shoulder or adhesive capsulitis, the inflammation, scarring happens in the rotator interval along with the capsular thickening, and hence there is thickening of the CHL or the coracohumeral ligament. Let's learn about how a normal capsule looks like. This is a normal hypointense jet black structure which is thin and not edematous. And this is the rotator cuff. This is the supraspinatus tendon which is inserting well. So the idea of showing this case was that whenever you see a patient who has scarring in the rotator interval, like in this case, but the inferior capsule is bang normal, do not label this as adhesive capsulitis. Adhesive capsulitis has to be labeled only when the capsule is thick, it's edematous, and along with that you see scarring in the rotator interval. So do not overdiagnose it. Always look at the clinical notes, talk to the patient if need be, or to the clinician.